Thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today, I'm joined by Chris Wasden, the Chief Strategy Officer at Twill Health. You may have heard of this is a new name for the company. Previously, they were called Happify Health, and we're really excited to have you on, Chris.
Thank you. I'm great to be here with you and look forward to our discussion.
Well, I'd love if you could tell the audience a little bit about your background, and
Sure.
then we'll dive into Twill.
Sure. So I've been around the block a few times. When people hear me go through my background, they ask if I'm a million years old. But started my career on Wall Street with J.P. Morgan for about a decade, did corporate finance, investment banking, then moved to Main Street as the CFO of a large private company for a few years, and then started a career as a serial medical device entrepreneur. Started a couple different companies, raised venture capital, angel investing, hired teams, took products to the FDA, commercialized them, sold to companies. Then joined PwC to start and lead their strategy innovation practice about the time the iPhone came out. So all of the work that I did there as their global healthcare innovation leader was focused on the application of digital to healthcare. So I had large pharma clients, I had healthcare payers, providers, and then a lot of telcos. I did work for AT&T and Verizon and Telefonica, as well as for Qualcomm Life or Qualcomm. Qualcomm Life is their healthcare business, and then Intel. Did that for about 7 years, and then got hired by the University of Utah to start and run a digital therapeutic incubator for them. That was a partnership with the business school, the medical school, and the video game school. They have one of the leading video game schools in the country, and did that for 5 years. And with that, ran a global video game competition with students. We had hundreds of students from dozens of countries and universities that competed for $70,000 of prize money to design games that would make you healthy. And during that time, I was approached by MetLife, the large insurance company, to find the best digital mental health company in the world. So I did what all professors do. I got six of my students to spend a semester trying to find this company. And so at the end of the semester, we found Happify Health and identified them as the best. So I took them to MetLife, and MetLife said, "Great, now can you introduce us and help us?" So I introduced Happify to MetLife, worked with them for about a year, spent another year after that working just with Happify Health. And then after that, I'd by that time been at the university for about 5 years and was ready to try something new. And so Happify said, "Chris, come join us and start the pharma business for us." And so that was 4 years ago. And that's what I did for the first few years here, as well as corporate strategy. And then recently I transitioned out of running the commercial part of the business, and I just do the corporate strategy now.
It's certainly it's been interesting to kind of watch Happify Health's progression, and it was really cool to see the name change. I always liked the Happify Health name, but can you talk us through? I know you mentioned a little bit about the rebrand. Can you talk us through what this means for the company moving forward? And then I guess a part two to that, what do you think this means for the healthcare industry as a whole?
Yeah. So the problem we had as Happify is that we were one of the best known mental health companies probably in the world. If you look at whenever anyone creates the top five mental health apps, we're always in the top five. Right? We're always selected. We're always published about. But the problem was that notoriety really was bounding and limiting us because we were known as just this mental health wellness app company. Yeah, we had lots of media, lots of press. We didn't even have to pay for it. But it focused people on that part of our business, and they really didn't focus on all the things we have done since we launched Happify, which was we've been around 10 years. We launched it, 8 years ago or so, 9 years ago. So the package of Happify was just too constraining for our ambitions about what we wanted to become, and wasn't a good reflection of what we had become as well. So we realized several years ago that was the case. So this is not something we woke up yesterday and decided we had to change the name. But the question is, what had we become, and what was the story? And I wrote a book several years ago called "Tension: The Energy of Innovation," and in that book, I talk about how simplicity comes from complexity. Simplicity doesn't come from simplicity; it comes from complexity. It's where you take all the complex and you simplify it down. And as we had grown and developed, we had become quite complex. We had come up with lots of different products and brand names for those products, and it was just too complex. It was too confusing, and so we needed to simplify the complexity. And what Twill has been is an effort in simplification. So we can now simply describe what we do. So our strategy is precision care. What that means is that we deliver uh, the part of precision medicine, which is digital therapeutics, digital services, with a step care model around patient care, which can include coaching, therapy, physicians, and whatnot. And we combine those together now to have precision care. So we can now engage patients regardless of their condition, level, severity, type of need, so that we can then achieve our mission statement, which is close the gap between need and care as quickly as possible to give patients the right therapy at the right time in the way that they want it. And we do this through sequences. And a sequence is a bespoke collection of digital and virtual services that enable us to provide the care patients need in the therapeutic area. So we have a sequence around multiple sclerosis. We announced our partnership with Biogen recently around that. We have a sequence in pregnancy. We announced our partnership with Anthem around that. We have a sequence in psoriasis. We have a couple of different pharma partners now already announced around that. And then we have a sequence around mental health, which is really our core as a company that we've been at for a long time, but is really not just the core of what we do, but it's also the core of what we're doing in other areas where we're connecting the mind and body. And so what Twill really represents, if you think about the metaphor, what Twill is fabric, right? So the metaphor is that we are untangling all the complexity of healthcare, and then we're weaving it together into a holistic, more rational, more elegant, more simple experience for patients, so that we can then better guide them on their patient journey towards getting the right care that they need at the right time and the way they want it to shorten the distance between need and care.
Now, when companies go through this rebranding process, um, what I've noticed, what I've seen in the past, what I've noticed is, there's some cool things to follow. What's next for Twill Health that you can share? I know there's some stuff that you probably can't share, that I guess everyone else that's fans and outsiders looking in can get really excited about.
Yeah. So it does come back to our core strategy. So when we think about precision care and the way that we deliver it, we call intelligent healing. Uh, it's going to be continuing to add products and services that increase the depth and the breadth of our precision care solution in these therapeutic areas, so that it becomes the best location for patients with MS or psoriasis or pregnancy or mental health conditions to get the sort of services and help that they need, regardless of what drug they're on, regardless of what type of clinician they work with, regardless of which health plan that they're part of, regardless of who their employer is. And so you'll continue to see us play very broadly from a product perspective, where we'll continue to be in the wellness, the non prescription digital therapeutic, and prescription digital therapeutic space, and then expanding into these virtual care services. So we've already got coaching, we'll be expanding other sort of virtual care. You'll see us continue to play broadly with regards to the type of customers that we have: employers, health plans, specialty pharmacies, pharmaceutical companies. And that's because at the core of who we are is we are a patient-centric company. Our co-founders came from a direct consumer business in the video game industry. We are very patient-centric in all that we do, and what that means is that this person that we support is sometimes called a member of a health plan. There's the same person sometimes called a patient by a doctor or pharmaceutical company. The same person is sometimes called an employee by an employer, but they're the same person. And yet, all these different stakeholders are trying to provide them different apps for their health, which creates tons of confusion for them. So they've got some from their employer, and some from their health plan, and some from their doctor, and some from their drug company. Well, they don't want 100 different apps for this one person that really has the same condition, regardless of whether or not they're an employee, a member, or a patient. And so by being patient centric, we're trying to simplify all that complexity so they have an integrated digital experience that can give them access to the care that they need when they need it.
Well, it'll be really interesting to see how the company continues to evolve. And again, I like the name. It was everywhere over the last. I think it was today, right? Was today the big
Yesterday was
announcement,
the
or
official launch
yesterday?
day. Yeah.
Yeah. Well, kudos to you and the rest of the team. Anything else that you want to tell our listeners that we didn't cover here today in this quick episode of Slice of Healthcare?
Yeah, so I think one thing that you asked at the beginning that I really didn't address yet, which is what does this mean for the healthcare industry? And I think what is important here is that we believe as a company that precision care will emerge as the dominant paradigm and strategy for all successful digital health companies, where you can no longer be a point solution. We believe that point solutions are dead, they're yesterday's approach, and that as we talk to employers, health plans, healthcare providers, pharmaceutical companies, patients, they all want these integrated total solutions that deal with the whole person, the whole patient. And they don't want to have a dozen or more different types of solutions. And so the way that organizations are going about this, and you see this in the M&A activity that's going on in the digital health arena, that most of the M&A activity you see out there is driven by a precision care strategy, where organizations that are telemedicine companies realize they need a digital therapeutic, so they merge. Companies that are a digital therapeutic company realize that they need telemedicine, so they merge. Um, and companies that are direct to consumer with some clinical support are merging because they realize they need to have the wellness and the digital therapeutics and the clinical care. So you're going to continue to see this be the primary driver of M&A activity in this industry as companies try to cobble together through these different deals precision care. Now, you'll notice we haven't done M&A deals to deliver precision care. Part of this is because we were designed at the outset as a company to have a robust, broad, and deep platform technology that we could then add all of these services onto, and that we also can integrate third party services into our platform as well to deliver them to the patients and our customers. And so this strategy is really, and what we're doing with Twill Care now and Twill Therapeutics and the whole Twill Health approach is now providing a model that others can easily see with regards to what is a precision care strategy and company, how we deliver it through intelligent healing, and what the dominant paradigm will be for the future of this industry. And you'll start to see other companies copy.
Yeah, it'll really be interesting to see how this name change just reshapes both obviously everything that you're doing and then how it affects the rest of the healthcare industry over time. And I'm glad that you did mention that we missed that piece because I did not want to leave here today without having you cover that.
Yeah, good. Enjoyed it.
Thank you so much, Chris, for joining us. We'll have to have you come back on. We do a lot of panels and stuff too. Maybe we can get you on with a panel. Um, and we've had people from when the company was Happify Health. We've had I think your chief product officer and what was it, Acacia Parks, who was no longer with the company, but she was at one point. We had her on as well. But it was great having you on.
Thank you very much. Appreciate it.